Hello, hello, hello. Welcome to Lisa Moss Medicare, or welcome back if you've been to the channel before. This channel is all about Medicare, especially Medicare education, so you, the consumer, or you, the agent, can learn what Medicare is about and the ins and outs of this confusing system. Now, I don't work for the federal government, and I don't work for the Department of Medicare. I'm a licensed agent. I'm a broker. What does that mean? Well, a broker, I work with all the different companies, except for one, in my area. So I can look at all the policies, all the companies. Everybody's different. It's like going and buying a car. Some people like trucks. Some people like Priuses. Some people want to use the train. So everybody's different. They have different drugs, different doctors, live in different counties. So it's really important to know about you and what you're wanting, because there's all kinds of different companies and all kinds of different policies. I'm going to show you my information. If you have questions, you can always call me. My direct line here, I'm in Southern Idaho. I work with Idaho. I actually have about 18 states I work with. And if I don't, I can help you find somebody that's really good in your state if I'm not licensed there. My direct line, 208-544-5011. Or you can email me through my website, insuranceover65.com. One other thing on the website, look at the articles. There's over 30 articles there that have all kinds of information about Medicare and Medicare related. So if you are wanting to know something and you can't happen to find it on Google, check that resource. It's a great one. Insurance Over 65 under the articles. All right, so what are we talking today? Overpaying for Medicare, or on the flip side, saving money with Medicare. Well, the first thing you're going to want to do is choosing the right plan for you. Now, when you first sign up for Medicare, remember we talked about you sign up for A and B, but it only pays for 80%. So you have that 20% gap. You can go option one, a supplemental policy and a standalone drug plan, or you can do option two, which is Medicare Advantage. Very different programs, very different cost. You always have to pay for your Part B, which here in 2024, it's $174.70. So rounded off $175. With a supplemental, you're going to also pay an additional $150 to $200 depending on where you live. And let's round off about $50 for your drug plan. Ching, ching, you're looking at about $400 a month. However, pretty much pays for everything except maybe a small deductible of $240. However, it pays for everything, and you can go anywhere you want. If that's too much, $400 a month approximately, look at Medicare Advantage. They put everything together, they bundle it, and it's managed by an insurance company. So you've got A, B, your 20% gap, so your supplemental 20% gap is in there, and usually a drug plan, and you don't pay anything for it except along the way as you use it. You pay co-pays, co-insurance. So per month, you're only going to be paying that $174.70, approximately $175 a month for your Part B. However, you pay a little bit along the line. If you go to, say, a hand specialist, you may pay a $40 copay for a specialist, or some blood work, you'll pay a little bit along the line. But as far as your monthly premium, if you want to save some money and not overpay for Medicare, I would go and look at the Medicare Advantage plans in your area. Of course, you got to look at your area, your county. We have a lot in our county, so there's a lot of choices. Some very rural areas don't. So make sure you just don't pick it for the cost. Although cost is a factor, you want to also look in detail of what the policy is. You also want to make sure you enroll in the correct prescription drug plan. If you're taking a lot of drugs, and I would say on average for my clients, they take 7 to 8 drugs. All the drugs are on formularies. Remember, formularies are 1 to 5 categories, 1 being the least expensive, 5 being the most expensive. If you've got a lot of really expensive drugs, definitely check out the different drug plans. Because if your drug plan, your drugs aren't on the least expensive, like the 1 or the 2 category, and they're in 3, 4, and 5, I can guarantee you those formularies are going to change a lot from drug plan to drug plan. And remember, Medicare Advantage includes that drug plan. So you want to compare apples to oranges of what those drug plans can give you. And they're not linear. A 50 cents a month drug plan versus an $83 a month drug plan. It may be that the 50-cent drug plan's a better shot for you. It all depends on what drugs you're taking. So that's another way to save some money and make sure you're not overpaying, is double check what drug plan you're in compared to the other drug plans in your county. Remember, if you move, you also have to get a new drug plan in a new county. So your supplementals, not so much, but your drug plans and your Medicare Advantage policies, yes. You also want to review your policy annually. You're going to get what's called an ANAC letter in September, an annual notice of change. It'll show you what the changes are like this year. You'll get it around September for the 2024 plan that you are on to the 2025 plan of that same company, the same plan, the changes that take place. Look over that very carefully. Call your agent. If I'm not your agent, then call whoever your agent is. If you want me to be your agent or have questions, you can always call me as well with questions on that. I do a spreadsheet for my clients every year that say, okay, if you're on this Humana PPO, if you're on this United Healthcare, Molina, Blue Cross, whatever policy that you're on, Aetna, we'll show you the changes from year to year. So that's really important, your annual notice of change. They are responsible to send that out to you every year in the fall. Usually it comes sometime in September. All right, next, generic drugs versus other types of drugs. If you can take a generic drug versus your brand name drug and it's the same exact drug, it'll save you heaps of money. So that's something that you can talk to your doctor and your pharmacy about and ask them, is there a generic for this drug? Most of the time there is. Most of the time your doctor usually writes that as a prescription. However, not always. So that's something you want to look at. Pharmacies also. There's preferred pharmacies, there's standard pharmacies, there's mail order pharmacies. Double check the prices. You can do that online with your company. You can do that with your agent. You can do that by calling the company on the number. That's the member services number on the back of your card. Call them and say, hey, I'm taking these drugs. What's my best choice for pharmacy? Always your preferred pharmacy is going to be your least expensive. Your standard pharmacy is going to be a little more expensive than your preferred. And depending on the drug, depending on where you live, your mail order pharmacies can also save you some money, but it depends on the drug and depends on where you live. You might also think about, if you're in a network plan, an HMO, a Medicare Advantage HMO, you want to look at staying in your network. Generally in our area, we have a big network. Most of the physicians are in the network. So you're in network. So it's going to cost you a lot less money than if you go out of network. So if you have a doctor you want to go to, just double check with your plan, make sure they're in the network. Or if your plan happens to pay money for out of network. I know we have a PPO that it pays in and out of network the same price approximately. That's great. Also, we have an HMO plan that gives you $2,500 to go out of network because we're located really close to Utah. So we're able to switch over the border, but that particular policy just gives you funds to use in that state rather than working with the providers in or out of network. You can switch, as we talked about, from a supplement to a Medicare Advantage plan. If you're in a supplement for years and your budget changes and it's just costing too much money for your supplemental plan per month, you can save a couple $100, generally speaking, on switching to a Medicare Advantage plan. In order to switch, it will be open enrollment, which is October 15th through December 7th. And those plans start to be activated the first of the year. So you would stay in the plan that you're in until the first of the year when the new plan kicks in for Medicare Advantage. Save some money that way. If you need durable medical equipment, such as walkers, hospital beds, things of that sort. Um, just ask if it's generic durable medical equipment and what the cost is. A lot of times those are 20% of the cost. However, there are places that charge less. Also, one of the things that people are doing here in our county is they're going to their senior centers. I know we have a lot of senior centers that have a whole basement full of wheelchairs and walkers and all kinds of medical equipment where you don't have to pay for it. They'll just give it to you. So check in with your senior centers. That's a good resource here in our county. Telehealth services. You know, a lot of times you'll go to your specialist doctor. They'll charge you a $40 copay. However, there's telehealth providers that you can call in to an 800 number and they don't charge you anything. Double check with that. Some of the providers are starting to charge for telehealth services and are starting to charge an additional fee. So just double check before you start going down that avenue that they don't charge you anything. Be mindful on your deductibles. You know, there is most Plan G supplementals have a $240 deductible. So as you go to your primary care physician or your specialist at the beginning of the year, you're going to have that $240 deductible. Double check on that. After you use that up, it's zero for supplemental. Some of your Medicare Advantage plans, of course, have deductibles too. So one good example is teeth. You know, you may have $1,500 for comprehensive for dental and you used it all up. Well, if you wait till January of the next year and that plan is still offering the $1,500, then you have a whole nother $1,500. Why not wait till January if it's the end of December and it gets paid for? So keep in mind on when those deductibles start and when they end. That can also save you a little bit of money. If you can have an HSA, a health insurance plan that allows you to put money in, especially those of you that haven't retired yet, utilize that. Once you retire, you're not able to put money into those resources, but before you retire, you can. So that's something that is really a good thing to look into. Medicare Advantage, make sure you compare your plan year to year. If your agent doesn't call you in October, give them a call. Make sure you check in because your plans are going to change, especially for 2025. There's some big changes coming up for this coming year. We won't know until October 1st. Once October 1st hits, we'll know of what those changes can be. You don't want to be caught in the maze in January and go to your doctor or go pick up your drugs and they're not covered. So make sure you check in with that. Or if there's any radical changes, you may want to go to a different carrier, a different plan. There's all kinds of new carriers too that are coming into the marketplace. We had Aetna come into our marketplace last year for Medicare Advantage plans, and it's a terrific plan. They took out some of the other percentages of the other carriers because their plan's so good. So that's another reason to check in every year in October for those plans that start in January. Preventive screening, that's a good one. Every year, there's a whole list of preventions that you can do that don't cost you a penny and may help you not have big insurance policy plan deductibles later on because you nipped it in the bud very quickly. So utilize that. Once a year, you can go see your PCP provider, your primary care physician. Definitely check in with that, maybe do some blood work, do all of those freebies that you get with your plan. Drugs, you can ask for discounts at the pharmacy, you know. Also, if your drugs are really expensive, and we still have the donut hole this year, which is a gap that you go into after you've paid X amount of money, there's this 25% gap that you go into for a period of time before they cover all your medications. Well, if you're in that gap, you can actually call the drug company and say, look, I'm in the gap. I can't afford this. Will you help me? I know one lady that I talked to, her drugs were over $7,000 and they got it down to less than $100 just while she's in the gap. But that's the most important part. After that, comprehensive takes over and you don't have to pay anything. So double check with that. Double check with your pharmacy, double check with your doctor, and double check with the drug company. You also have some GoodRx coupons that the pharmacies can help you with as well. So if you have a high cost in your prescription drugs, double check those resources. IRMA. IRMA is when you pay more for your Medicare Part B. If you make more than, I'm going to say the cutoff's 103,000. I can't remember exact amount, but you can check with your accountant on that. Then you're going to get an extra charge. And it's really a taxation. It doesn't make any sense to me personally. I feel like we all worked all these years, whether you worked and made a lot of money or you worked and made less money. We all worked and put into the system. But if you're working, it goes back 2 years. So if you retire and you're making $600,000 a year, you're going to pay more for Part B, the $174.70. You're going to pay more for it. You can pay up to $500, $600, $700 a month for that, and it goes back 2 years. So double check with your accountant. There's things that you can do that can help you with that IRMA. You can maybe wait a little longer to retire. You can work with your accountant and maybe shift some funds around. I don't know the accounting portion of it. Check that out, though. You don't want to be hit with high IRMA taxes, because that's what they are. They are taxes. I want to say it's a $206,000 for a couple and $103,000 for a single. And there's a 2-year back dating on that. So double check that. Also, eligibility for Medicaid and low-income subsidy. If you make less than $1,800 a month, especially around $1,200 a month, and less than $16,000 in assets, there's a real good chance that you can apply for Medicaid and get it. If you apply for Medicaid and receive it, they'll take care of your Part B. They'll take care of a lot of your prescription drug costs, and a lot of times give you extra allowances for food, for transportation, for pest care and pet care as well. So if you can apply for additional benefits, do so. All they can do is say no, right? You may not qualify, but you'll never know if you don't apply. So Medicaid, you apply with Health and Human Services. Low-income subsidy, which I believe is under 103,000, you may be able to get some aid by your state. So you can go to the Social Security office and apply for low-income subsidies through the state and through the federal and see if you get that. If you can get that, there's also additional policies in our area. We have Molina. We have a partial that, especially if you have diabetes or some, serious condition, they'll give you extra food. They'll give you $325 towards transportation. There's a lot of extra benefits. So double check if you can qualify. Why not apply? All they can do is say no. So that's something to look into. There's special needs plans. Those are the ones that are Medicare, Medicaid. And also, if you go into a nursing home, there's institutionalized plans that give you a lot of extras too. Transportation's a big one. We're finding that more and more the facilities will only take you to your doctors. They won't take you to Walmart, or they won't take you to the grocery store. So transportation's a big one. So a lot of those policies have additional transportation, which can save you some money, right? You don't have to pay for an Uber right up front. You can pay out of your little debit card that they give you. It's usually a Visa card. That's about it. That's all I have for you today. If you have any comments or questions, just email me. Let me know. I did get a comment from Dr. Gary Daniel. Thank you, Gary. What do you do if your doctor's office keeps screwing up your billing with Medicare Advantage? That's a really good question. Is it your doctor's office? Is it the hospital? Or is it your plan? If it's your doctor's office, then you've got to check in with your doctor's office and find out what their billing codes are and make sure they're putting the right billing code on your bill. Are they coding it as just a primary care physician yearly office visit, which is $0? Or are they billing it part that, part something else? I know a lot of times they're starting to bill differently. So that's what you can check in with your doctor's office. Just call them up and get the billing department. You can also go to your agent. Like my clients, we have a whole system called Spark, and I have 3 people that I put in a work order, and they are responsible for finding that out of why are you getting additional billing. Sometimes the billing goes towards your deductibles. Some of these plans have a $250 drug deductible or even a whole plan deductible before they start paying. So it may be the money that going towards your deductible. But the 2 main thing is first call your doctor's office, talk to the billing department, then call your agent and see if they can help you with that. Good question, Gary. Thank you. All right, well, that's it for me today. I'm going to go ahead and put my information up again if you want to reach me. I'm Lisa Moss. I specialize in Medicare, and also happy Flag Day. Today is annual Flag Day. It's July the 14th of 2024. Have a beautiful weekend. I won't be here next week, but I will be here. Just take a look on YouTube. We're not posting on Facebook anymore. They've changed their rules, but we do it on YouTube almost every week. If not every other week, we're up. So there's a whole data of information on YouTube from past ones too. Have a great weekend, everybody. Thanks for watching.